Well, happy Global CE Day, everybody. I'm here this morning with Bassam Tabshouri, very experienced clinical engineer from Beirut, Lebanon. Good morning and good afternoon to you, Bassam.
Good morning to you, Tom, and good afternoon to Kelly Royd.
Tell us about this important job you've had in Beirut for many years in clinical engineering, please.
Thank you for asking. In fact, my work stretched for over 40 years, and I have seen a lot of things going on. As you know, the situation in the country, the civil war, and what was more challenging is really that our institution, the American University of Beirut, belongs to two ecosystems. So physically we are in Beirut and Lebanon, but at the same time we were challenged to meet US standards. Any country that has a lot of problems and rather very little resources.
So Bassam, tell us, I mean, as you say, multiple issues going on, challenges in government, challenges in COVID, and challenges in the explosion that rocked the city. Tell us what it's been like during all this, in the past 2 or 3 months.
In fact, before the explosion, what we did, the clinical engineer teams, especially our group, the healthcare technology management and advancement, we were very proactive in trying to set standards for the development of certain medical devices and protection devices. And some of our teams worked on developing like ventilators and other things. So that was one track we worked on. And now the issue of the explosion was really something like a mini nuclear explosion. The most impacted areas were in East Beirut with our friend Riyadh. And I'm sure you had seen the videos about the devastation. It's gonna take them a long time to recuperate. But we're trying to provide help as much as possible.
Well, I know there's been a lot of heroes, both on the care delivery side, the nurses, the doctors, but certainly from clinical engineering staff. Do you have any anecdotes about that with your team that you could share?
Yes, fortunately, our hospital was not that much impacted like that of St. George and other hospitals in Beirut. So we're trying to provide any help we can do for them. Now, for Riyadh, it has been a very daunting experience because a lot of the equipment was severely damaged. And as he mentioned in a previous interview, he had to work on different levels, including medical records, cleanup, surveying the equipment, trying to fix what you can fix. A very challenging thing during this part of our history is the availability of parts. Because of the economic situation, it is very hard to transfer foreign currency abroad.
Well, Bassam, I know you and Riyadh have led together for years, and you've been a key leader. You guys created a national society. Can you tell us about that for clinical engineering and HTA and so forth?
Thank you. Yeah. In fact, we opted to go a bit out of the box because, we realized that those who deal with the medical healthcare technology are not only the engineers. And a lot of the issues that you need to handle in terms of technology or the hospital or the healthcare system, many other players are involved, including like nurses, doctors, administrators, people in public health, and so on. So we opted to have our organization, which we started as biomedical engineers, and we are the key players, to include the other stakeholders. And so far, it has been really a very rewarding experience, despite the fact that we have been running for only 3 years.
So what's the name of your organization and how many people are involved?
The name with healthcare technology management and advancement, and practically we have few hundreds of biomeds. But for example, the Order of Nurses in Lebanon, they are officially represented in our association. So they have 15,000 members, but definitely not all of them not the members, their members are not on board. And similarly with the order of physiotherapists. So we're trying to build this network and have more multidisciplinary interaction.
Well, I know you have not only been inward focused, but also outward focused, and you and Riyadh and others have been a part of a steering committee for the whole region, IMRO, Middle East, North Africa region. Talk a little bit about those activities and what you're hoping to do in other nearby countries.
In fact, we were planning to have a major regional conference this year in November, which would involve definitely IFMBE, ECCE, AMI, other groups from Europe, and mainly the ministers of health and finance in the Arab region. Unfortunately, we couldn't materialize it because of the COVID, but we still have it on our radar, and hopefully it will occur in Dubai.
Well, very good. I know you were a key speaker at the IMRO CED WHO program in July about the impacts of COVID. And so that and other developments in countries like Egypt and Saudi Arabia and others are things that you and Riyadh and others are trying to encourage. So what's your vision for the future of clinical engineering in Lebanon as well as in the MENA region?
Definitely the COVID issue has put us in a very different kind of world. Surely the biomeds, the clinical engineering profession is now more recognized. We're gonna see a very different practice of clinical engineering, especially with the telemedicine. And as we hear from WHO, it's gonna last for the coming 2 years. So it's really a very challenging area, and I really can't exactly forecast how it will be.
Well, thank you. Any closing words of encouragement to your colleagues around the world on Global CE Day?
Yes, we have done a great job so far, and thanks to everybody. We are the soldiers on the front lines. Not many hear about us. The important 4 things, according to McKinsey, which is really now needed in terms of skills, in addition to the digital know-how, are resilience, emotional intelligence, social intelligence, flexibility, and adaptability. And I am sure all of us as clinical engineers will shine in that and give a very different positive input to all humanity.
Well, Bassam, thank you for your long-term faithfulness over 40 years, as you said, to our profession, and thank you for your time today.
Thank you very much, Todd and Kelly-Roy and IMB. It has really been an honor and a great pleasure. And all the best for our colleagues for this very special day for all of us.
Very good, and bye for now.
Bye.